My greetings to everyone watching this video, in which I'm going to talk about Swiss Natura IRS, Inflammatory Response Support, the phytoextracts liposomal supplement. The main purpose of this liposomal phytosupplement is to reduce systemic inflammation, which is one of the constant and significant factors contributing to aging and age-related diseases, reduce chronic aches and pain, especially joint pain caused by osteoarthritis, and reduce the intensity of the cartilage damage and cartilage degeneration, which occurs with age. Swiss Natura IRS contains three main ingredients: Resveratrol, Epigen, and camphorol. I have a separate video dedicated to Resveratrol, which you can watch on my Instagram page, Dr. Dmitrok Local, and my YouTube page, Global Biohack Alliance. In that video, I talk about Resveratrol in details, described its health benefits and expected outcomes from supplementation with Resveratrol. Resveratrol is a versatile natural compound with multiple therapeutic effects in cardiovascular diseases, metabolic syndrome, diabetes type 2, and even neurodegenerative diseases. It has anti-inflammatory and antioxidant properties, but most importantly, Resveratrol activates sirtuins. Hence, it promotes repair of the DNA and maintenance of the healthy epigenetic status. Epigen is a naturally occurring polyphenol flavonoid characterized by broad biological activities, acting as a free radical scavenger and antioxidant, exhibiting anti-mutagenic and anti-inflammatory and even antiviral effects. It is able to reduce plasma levels of low-density lipoproteins. It inhibits platelet aggregation and reduces cell proliferation. Epigen is an extremely fascinating and promising compound. A high number of studies carried out over the years have indicated that Epigen has many interesting pharmacological activities and nutraceutical potential. For instance, its properties as an antioxidant are well known, and it can be also used as a therapeutic agent to overcome diseases like inflammation, autoimmune, neurodegenerative diseases, and even several types of cancers. Compared to other flavonoids, Epigen has a low intrinsic toxicity on normal versus cancerous cells. Apart from that, anti-inflammatory and antioxidant function. Epigen induces cell cycle arrest at different proliferation stages, including G1S phase or G2M phase. Epigen can regulate intrinsic apoptotic pathways, changing mitochondrial membrane potential and causing the release of cytochrome C into the cytoplasm. In cancer cells, Epigen activates apoptosis, the programmed death of cancer cells. Epigen is also reported to induce the inhibition of metastasis and angiogenesis by interacting with the signaling molecules in the three major mitogen-activated protein kinases. Besides that, after absorption into the digestive tract, Epigen is able to reach the brain through the circulatory system, where it can cross the blood-brain barrier and applying its affinity with the GABA receptor and acting beneficially on the central nervous system. Epigen exerts neuroprotective effects in Alzheimer's disease and Parkinson's disease patients. As for the osteoarthritis, Safety and efficacy of Epigen was studied in a double-blind randomized clinical trial involving patients with knee osteoarthritis. In that study, Epigen has shown a remarkable effect of significantly reduced the demand of painkillers and anti-inflammatory medications in patients with knee osteoarthritis, thus improving their physical function. The third ingredient, camphorol, is also a polyphenol antioxidant found in fruits and vegetables. Many studies have described the beneficial effect of camphorol in reducing the risk of chronic age-related diseases and even cancer. Camphorol may help by enhancing the body's antioxidant defense against free radicals, which promote the development of cancer. At the molecular level, camphorol has been reported to modulate a number of key elements in cellular signaling pathways linked to apoptosis, angiogenesis, inflammation, and metastasis. Significantly, camphorol inhibits cancer cell growth and angiogenesis and induces cancer cell apoptosis, but on the other hand, camphorol appears to preserve normal cell viability and even exerting a protective effect on normal, healthy cells. Interestingly, that camphorol is closely investigated from the point of view of nanotechnology. In the form of nanoparticles, camphorol achieves highest level of bioavailability and produces the utmost strong effects. Who can and who should not use the Swiss Natura IRS phytoextract liposomal supplement? As I have mentioned in the beginning of this video, individuals with chronic low-grade systemic inflammation, osteoarthritis, and even rheumatoid arthritis, as well as people suffering from all sorts of chronic aches and pain, are the main target consumers of this wonderful product. Because of its mild pro-estrogenic properties, women and men who are estrogen sensitive should get a professional opinion from their doctor before using this supplement. In addition, it may have some interactions with blood thinners such as warfarin, so get your doctor's advice on this first if you are on one of those medications. And most importantly, at all times, stay healthy, be alive, and have fun, or at least try to do so. Thank you for watching this video. It was Dr. Dmitry Oklokal here with you. Bye bye. Cheers.